Irregular menstrual bleeding can never be normal. It is always attributed to some medical condition in the body, particularly if this bleeding is happening after sexual intercourse, any medical examination, or there is menorrhagia, which means that there are increased number of days in your menstrual cycle, or you are having menstrual periods when they are not expected. And more so, if they are also associated with some foul smelling discharge, it may indicate that it may not just be a simple pelvic inflammatory disease, it can be carcinoma cervix as well. So it is important to recognize these alarms in the body. The first and the foremost thing one should do is seek a gynecological evaluation if you encounter any bleeding, because there may be bleedings which are associated with some hormonal imbalances in the body, which can be very easily treated. It can be because of certain traumatic erosions, which can also be treated comfortably. And even if it is carcinoma cervix, if it is picked up well in time, it is a very curable disease with cure rates of almost 80 to 90% in first stage. So that is the importance of recognizing these symptoms of bleeding. If you ignore the symptoms of bleeding, the disease may advance slowly and slowly in a bigger stage, when the chances of cure also fall down, and also there is a chance that you will require more and more intense treatments like chemotherapy as well as radiation to achieve cure and from preventing the disease coming back. So, if there is any irregular bleeding, I again remind you, which can be postcoital bleeding, bleeding after any medical examination, irregular bleeding when the menstrual cycle is not expected, postmenopausal bleeding, when you've attained menopause and you still start to bleed, these are the alarms of your body. Do not ignore them.